The SuctionPro 72 suction catheter is a single patient use, closed suctioning device intended for the removal of secretions from the tracheobronchial tree of ventilator-dependent patients. The SuctionPro 72 is available in various configurations and sizes. It's available with dual swivel elbow and T-piece connections, single and dual lumen catheters, as well as tracheostomy and endotracheal tube lengths. This gives you the flexibility to choose the device that best meets the clinical requirements of your patient. Attach the suction tubing to the male connector of the SuctionPro 72 thumb valve. Place the cap on the side port of the T-piece which is not being used. An expandable flex tube is available for easy connection. This tube provides clinicians with the mobility to bend and shape the tube to the needs of their patient and reduces torque on the patient's airway. Attach the flex tube to the open side port of the T-piece and then attach the ventilator circuit to the flex tube. The single-axis swivel can also be attached to reduce torque on the patient's airway. Attach the T-piece to the endotracheal or tracheostomy tube connector. First, note the irrigation port location. On all single lumen catheters, this port is located on the dual swivel elbow and T-piece connections. On all dual lumen catheters, the irrigation port is located alongside and under the thumb valve. To lavage, hold the T-piece or dual swivel elbow while advancing the catheter approximately 10 centimeters into the airway, instilling saline solution through the irrigation port onto the catheter. When ready to suction, the thumb valve lock should be in the open position. Advance the catheter to the desired depth. If resistance is met, withdraw the catheter 2 to 3 centimeters before applying suction. Grasp the control valve and apply backward sliding pressure on the thumb valve to suction. Maximum suction is achieved by sliding the thumb valve actuator back completely. Slowly withdraw the catheter and ensure that the catheter tip is completely withdrawn from the patient's airway and is in line with the saline port. To clean the catheter, saline should be administered through the irrigation port while suction is applied, making sure that the tip and the surrounding area is fully flushed and cleared. Continue to irrigate and suction until the full length of the catheter and inside the thumb valve is completely cleared. When finished, end suction pressure by releasing the thumb valve and turn the thumb valve lock to the closed position. The suction source should be turned off when not in use. The SuctionPro 72 has been designed with patient safety in mind. The advantage is clear. The SuctionPro 72 incorporates several patient safety features. Each has been designed to reduce airway trauma and maximize clinical performance. A soft tapered catheter tip gently guides the catheter into the patient's airway. Eyelids are positioned on opposing sides of the catheter and are intended to allow the catheter tip to deflect in the event the tip makes contact with the carina during deep suctioning. The dual lumen catheter version allows for the pinpoint application of saline lavage directly onto thick and tenacious airway secretions, reducing the introduction of excess irrigate and improving the clearance of fragile airways. The dual lumen lavage technique also minimizes the risk of rinsing biofilm from the walls of the artificial airway. A robust wiper seal designed to clear away secretions from the outer side of the catheter also ensures no airway pressure is lost due to leakage into the catheter sleeve. Additionally, all catheters have printed graduation markings to allow insertion of the catheter to the appropriate depth. The thumb valve features a linear path for smooth passage of the suction material and ease of cleaning, reducing the likelihood of trapped material and microbial growth. A spring-loaded suction piston seals off the suction pathway within the thumb valve when it is not activated. An easy lock system is placed at the rear of the thumb valve and is activated by simply turning the lock cap clockwise. The thumb valve is made of a clear material, allowing operators to visualize the complete removal of all secretions from the catheter during suctioning and cleaning. The clear thumb valve material provides visual confirmation that the suction piston has reverted back to its closed position, and the catheter is completely sealed from inadvertent suction. Elevated safety wings provide a secure guide for the thumb valve actuator and prevent the patient from inadvertently self-suctioning. More traditional push-button thumb valves may be inadvertently activated by patient movement, such as rolling onto the thumb valve. The SuctionPro 72 has been rigorously tested and validated to withstand 72-hour use. It is durable and designed to operate as well on day 3 as it does the first time you use it. SuctionPro 72 eliminates the risk associated with off-label use of a 24-hour catheter beyond its approved indication. In a side-by-side comparison, the SuctionPro 72 outperformed the leading competitor, demonstrating greater suction efficiency when measured at the same suction pressures. Other suction catheters with push-button thumb valves force secretions to change directions multiple times, creating a tortuous path for secretions to pass through and thereby reducing suction efficiency. SuctionPro 72 offers reliable, highly efficient, powerful yet quiet, gentle suctioning. SuctionPro 72 was designed with your patient's safety in mind, reducing infection, eliminating risk, powerful yet gentle, protecting your patients. Safe, powerful, simple. The advantage is clear. SuctionPro 72.